second and final lecture with us here at the Monte Carlo Anti-Aging Conference. Please welcome back to the stage Dr. Thierry Hertog.
Thank you. Thank you, Phil. The subject of today is a very important subject because we all wear clothes, but next to our clothes, what do we look? We look to the hair of people or the face. And I'm going to talk about the hair. And having problems with your hair creates in a lot of people disturbances. And what I'm going to show is that hair loss problems or even body hair excess are not enough, are caused by hormone problems and specifically deficiencies. When there's an excess in a hormone, there's often a deficiency in another hormone, and the way to treat it is often not to stop the excessive hormone, but to correct the hormone deficiency. And I don't know how many of you have hair problems. Nobody, almost. I think a lot of you have a lot of hair, so probably you're well treated hormonally. But I'll show you what in your patients you can see. I'll probably have to wait a little bit. It has to load. And I will also have a pause after each slide, because it seems that the people who have to listen to the translation usually have the translation of the previous slide. So, it's very slow computer systems, very, very slow. It's to see if you have enough hormones to combat anxiety of not having the slides. So we'll see, it's only going to take half an hour for it to load. Oh, here it is, fantastic. So, this is a hair follicle, and it's made of a group of cells, as we're going to see. And there's a lot of hormones going to work on it. You see here, these are all small little cells lined up, sticking together. And in such a hair shaft, there's a lot of hormone receptors. Thyroid hormone receptors, you can find them all over, in each sort of cell. But you will find specifically a lot out here, where there's in the papilla, where there's proliferation of cells. So thyroid hormones are very stimulating for hair growth, and you will find a lot of thyroid hormone receptors where it should be. This is the hair cycle. We have usually our hair anagen phase, the phase of growing. You have the phase of catagen, where it's going to break off and die, and then it takes telogen. Before arriving in the telogen phase, it takes 2 to 4 years. So the hair we lose is normally already 2-year-old, 3 years, or 4 years old. That means if you want to have changes, it also takes a lot of time to have changes. This is great. When it's going to fall, it takes a lot of time. So when a person has hair loss with a round hair bulb, it is already detached 2 months before. So the question to ask when there's hair loss coming is, what happened 2 months before it started? Was there severe flu, or was there severe stress, or whatever? Stress or flu that has caused hormone deficiency. That means also when your hair is going to grow back, you won't see any results the first 2 months. It will take 3, 4, or even 5 months before you find differences with hormone treatments. New hair, old hair. And it is very important to know that the hair is completely embedded in the skin. That means that if something happens with the skin, it dries off, there's not enough blood circulation, there's not enough fibrous tissue, whatever, there will be problems with the hair. So hormone problems that gives a skin problem, we usually give hair problems. And the most important part that we have to look of is the blood supply. If a hormone deficiency creates a lesser blood supply, there will be hair problems. So what we're going to see today is the effect of hormones on scalp hair, but also on body hair. Both can create problems. And the quality of hair will be one of our major focuses, but also just global hair loss, or loss of body hair, or excessive body hair. So we'll try to feature. On melatonin, I'm not going to say a lot because I didn't really find studies on it, but melatonin is secreted by the pineal gland, and it gives the start of the hormone cycle. So it's very important. It's the chief orchestra of the hormone cycle. So if something happens with bad melatonin, for instance, there's not enough melatonin secreted at night, there will be lesser growth hormone, there will be lesser conversion of T4 to T3, there will be thyroid deficiency problems, growth hormone deficiency problems, and other hormone deficiency problems that will, on their turn, give hair problems. So let's look at the other. This is ACTH, very important hormone for hair. ACTH is the hormone who stimulates the secretion of cortisol and also of DHEA and aldosterone. When a person has total hair loss, like this person, there's usually, you have to know, a lot of hormone deficiencies. That means that if you give, you have to give a multiple hormone correction treatment in order to correct this problem that is correctable. But there's always ACTH in the treatment. Injections. And then hair comes back first in plaques. Afterwards it gets much more diffuse, it comes back. The color of the hair first is rather white when it comes back in total hair loss. And then it gets color, because ACTH is a pigment-stimulating hormone and has about the same actions as MSH, melanin-stimulating hormone. So probably in gray hair, there's also some ACTH deficiency, and people who have familially, very quickly gray hair probably have some sort of ACTH deficiency next to the MSH deficiency, as we will see. The lacking hormones that stimulate pigmentation. ACTH is secreted by the pituitary gland here in the brain. So any problem that happens with this gland may promote total hair loss. So the treatment is ACTH injections 2 to 3 times a week, 1 to 2 milligrams in a depot form, a form that is slow release in the muscles. Other treatments, major is thyroid hormones. I've become fascinated about medicine and endocrinology. After 2 months, I had a patient with total hair loss. And I worked with my father, who had some experience in this sort of treatment, and we gave thyroid hormones. There was thyroid hormone deficiency, and ACTH injections, and all the hair came back in 2 to 3 months' time. It was quite quick, except on the sides. And on the sides, it took a year or 2 to correct that, and we had to correct sex hormone deficiencies and probably growth hormone deficiency, because when a person gets growth hormone, especially the hair around here, on base of the scalp hair, gets much thicker. Cortisol also, but of course ACTH injections do increase the cortisol and do increase them sometimes too much, so you have to back off with the treatment, or they have a sort of gastritis. And what you should of course do is give good doses of DHEA, because the cortisol production will be more increased than the DHEA production by ACTH injections. What about gray hair? This is the only, I would say, problem that I have difficulties to correct. One of the reasons is because one of the products that probably, but I cannot be 100% assured, I didn't do enough experience on it, is MSH. And you see here some pigment cells. The melanin pigment is missing in the cells of the hair of persons who have gray hair. And so what I did, I was able to get MSH because I was in a society, the secretary of a big society, that could do animal experience. So I got them from Sigma, but I tried it on a human animal, was myself. Unfortunately, I don't really have gray hair, or not very much, but I had here, and I have some now, some blonde or white hair, or gray hair, and I took huge doses of high doses of vitamin B, because I had an experiment that was made in 1950s, I think, where huge doses were given of vitamin B to animals where they took off the adrenals, and that compensated very much for the graying, that combated the graying of the hair that they normally have in that case. And so I did the two, and it got completely colored here. But that's not enough. It's an anecdotic case report. Tried it on my father, who had gray hair, and he found that it improved, but I didn't find any improvement. It's no clear improvement, but he forgot to take the vitamin B. So it was very expensive treatment, because it's much more expensive than growth hormone. But so there probably is sort of association. But probably if there is a solution, I would say hormones that, in my experience, have improved the best, MSH, and giving testosterone and growth hormone injections usually stop the graying of the hair and seem to partially reverse it. Probably because they stimulate the secretion of MSH or SHTH or whatever. But now, what about globally growth hormone? Growth hormone is important for the scalp hair quality, and we will see why. It's secreted by the pituitary gland, but it can also be secreted by breast cells. It can be secreted also by other tissues. And when there's not enough growth hormone, we'll repeat, the person is rather small and a little fatty, and is too big when he got in childhood too much growth hormone. Now, the main action of growth hormone is to make hair thicker, makes all organs thicker. Hypertrophy, they're bigger. It also stimulates the sweat glands. Somebody who has too much growth hormone sweats too much. And growth hormone deficiency will do the reverse. It will atrophy of the hair, and they will get thinner. So thin hairs usually relate to a lack of growth hormone or even IGF-1. Now, it also will get drier because of the lack of sweat glands when there's growth hormone deficiency, next to the atrophy. This is the person with growth hormone deficiency. Very clearly, you see the sagging cheeks, the thinning of the lips, the nose tip was droopy, falling, the eyebrows who are thinning, and the thin hair. It is small, it is thin, and there's bilateral frontal recession that I partially attribute to growth hormone deficiency in my experience. And eyebrows are lesser. What happens in growth hormone excess will be, of course, completely the reverse. The hair will get thicker, there will be hypertrophy of all compartments of the hair follicle. Sweating will be increased, and the hair will also get oily because it sometimes stimulates, it pushes the testosterone inside of the cells. So there will be more sebum secretion. They will have a strong smell. The person with growth hormone excess has a stronger smell. Keep a little bit away from him. Want to survive? Oily and sweaty, thicker. You see how thick the hair looks? Like the very thick skin. And the eyebrows, very large. Big hair, thick. And bilateral is not so recessed. It's rather much less bilateral recession. see how thick the hair looks and how thin the hair looks when it's deficiency, and when there's too much, how thick the hair. See also how the chin is enlarged and the nose is enlarged in person with growth hormone excess. Now, too much or too low growth hormone could create problems. Here, too low growth hormone in progeria, typically progeria is typically a lack of growth hormone with other hormone deficiencies. You see the total hair loss, so think about ACTH, etc. And the treatment is probably of progeria, giving all the hormones and not only growth hormone. The growth hormone, the very thin chin, the very thin nose, the atrophy of the lips, very, very fine, it never has developed, the small ears, and there's total hair loss. And there was experiences done with breast cancer patients after operation. They got chemotherapy and they had total hair loss, and by giving growth hormone it seemed that it accelerated the recovery of hair. Now there is a study that shows that vertex balding in men at 45 years could be increased if the IGF-1 was higher. So high IGF-1, high growth hormone, could give vertex balding because it decreases the sex hormone binding globulin, and it pushes the testosterone in the cells that will transform into dihydrotestosterone. But also it's linked with a decrease in IGF-BP3. That means there's too much bioavailable IGF-1 because the transporting protein of IGF-1 in the blood is decreased. The IGF-1 will go too easily in the cells. But maybe it's not a growth hormone problem. Maybe this is the problem. You have to have high IGF-1 and high enough, not too high, IGF-BP3, and that is increased by estrogens and by thyroid hormones. So it could be a hidden deficiency in thyroid hormones and estrogens. Growth hormone in body hair problems, if there's not enough growth hormone, a man cannot have body hair. You need to have enough growth hormone to push the body hair on the body. And usually when growth hormone is given to a man, testosterone levels go down, but the free testosterone goes up because SHBG goes even more down, and there's more male hormones in the cells, and their sexual characteristics coming up. Now what about the thyroid hormones? Thyroid hormones are fundamental for hair. And I have always some sort of nostalgia when I talk about thyroid hormones, because my great-grandfather started with hormones, and it was with thyroid therapy, and he published a lot of books on this, and so it's a little bit and you see here thyroid hormones are made by the thyroid gland next to other hormones like calcitonin, and this is a person with thyroid deficiency, and this is a person with thyroid excess. Both extremes are not good, and this is valid for all endocrine problems also. Too much growth hormone or not enough is not good. So we really have to learn to stabilize growth hormone the best we can. And T3 is the active thyroid hormones, and T3 stimulates the blood supply very much. People have too much thyroid hormones, have a too high blood supply in the skin, and the hands and the feet are red, the hands, palms, typical sign. And it also stimulates the proliferation of the cells, especially here in the dermal papilla. And it stimulates the sweating. So those people who have too much thyroid hormones have wet hair. They have a wet skin, but also wet hair. And it also decreases the intercellular space and takes away the waste products, the myxedema. So that makes that if there's not so much myxedema or no myxedema anymore, the blood supply will flow better, nutrients will flow better to the cells, so that's good. That's why people unswell, have a sort of unswell looking when they take thyroid hormones and they had previously a thyroid deficiency. So it stimulates a lot of compartments and a lot of important things. And It is important to know that some of the positive effects on hair by growth hormone is because it accelerates the conversion of T4 into T3, the active hormone, so it can really stimulate this sort of thyroid action. If it's not excessive, of course. And then you have all the good effects of growth hormone and thyroid hormones combined together. That's why growth hormone can improve hair regrowth if it's not excessive. So thyroid deficiency will create the other problem. It will have a myxedema. There will be all sorts of waste products between the cells piling up, making that the blood supply is not so good. It will have, the hair will be thicker because there's myxedema between the cells of the hair, thick hair, but of poor quality. They will also make that everything's drier because there's not so much blood supply, there's not so much stimulating of the sweat glands here. And so the skin will be dry, but the hair will also be dry. And there will be dry cells piling up, not leaving, and you will have at each follicle, pillar follicle, the hair shaft, you will have at those parts piling up of keratin cells. And when you put your hand on the skin of a person with lack of thyroid hormones, it's a sort of bubble skin. It's not regular, rough skin because of hyperkeratosis pilaris, piling up of keratin cells on the top of the follicle. And there's a clear atrophy of the sweat glands in this thyroid deficiency. So you have all sorts of problems that make that it's difficult for hair to stay on the scalp. And so this is typically the lack of hair in thyroid deficiency. A picture of that my great-grandfather did of one of his patients, and you see it's thick hair, it's thicker, it really looks thicker, rough, irregular, it's difficult to comb, it's dry, and the reason I remember there's a lack of blood supply to the sweat glands and the hair shaft. It's brittle also, it breaks easily, splits in two. There's iron deficiency that can create that, but also thyroid deficiency splits. The hair nails also split in two in thyroid deficiency. And it grows slowly, typical. These are probably the most stimulating, the hormones that stimulate the best the hair, the quickness, the speed of hair growth. And typically, this is the loss of outer third of the eyebrow. In the French language, in the dictionaries, it's called also the sign of Dr. Eugene Hertog. My great-grandfather was the first to show this, being typically of lack of thyroid hormones since a long time. But to make the eyebrow grow back in aging adults, it's often not sufficient to give thyroid hormones. It's an association between growth hormone and thyroid hormones that makes the eyebrow much thicker again. Here's a study about androgenic hair loss, like in women. That is, those women who have this sort of hair loss have several parameters that tend to show that there's a thyroid deficiency elevated, like the TSH is elevated baseline. It's significantly elevated compared to controls for when it's stimulated by TRH, the TSH, plasma TSH after stimulation by TRH, and also prolactin. When prolactin is too high, one of the causes is the deficiency in thyroid hormones, and you have then androgenic hair loss much easier. So think about thyroid hormones, whatever sort of hair loss is. But the usual typical hair loss by thyroid hormones is a diffuse hair loss. That's most typically. Can we turn back a slide, please? And we saw this vertex balding in men was greater, but with a low IGF-BP3. One of the hormones that stimulates the increase of IGF-BP3, and at the same time an IGF-1 increases, is thyroid hormones. So it probably is a lack of thyroid hormones. are estrogens who can do that also. But I'm talking about transdermal estrogen in women as a treatment. And also, there's a study which shows that men who have higher testosterone levels have more androgenic hair loss. It will be surprising, this study, for what I will say you later on how to treat androgenic hair loss, but anyway, it's interesting to see. But they always have usually a low SHBG, and that is a typical sign of low thyroid hormones, or eventually low estrogens, but most often low thyroid hormones. So when T3 is excessive, there's too much thyroid hormones, we will have the reverse. Hair will be wet because there's excessive stimulation of the sweat glands. There will be a thinning of the hair because the intercellular space between the cells is too thin. And there will be also, in certain sense, a thinning of the hair. And it's not a good, even if there's a lot of blood fat, it's not a good situation to keep the hair. So it can also give a certain hair loss. This is a person with excessive thyroid hormones. You see this adrenal look, and the thinning of the face, because everything thins out. There's not enough intercellular space. It's thin, the hair will get thin, wet, smooth, like the skin gets, when it's not enough thyroid hormones, it's very rough skin, and the hair is rough. But the skin gets like a baby skin in an adult. That's a little bit too much then, with too much thyroid hormones. And the hair also gets very smooth. Too smooth to comb, doesn't hold. She probably did some product to hold it. Thin, wet, and smooth. And too much thyroid. And fast growing, typically fast growing. I have to go to the hair cutter every 2 weeks. And you see this diffuse hair loss in hypothyroidism. Well, with treatment, you see what difference just with treatment. No ACTH injection in this, just thyroid hormones. They didn't have an ACTH at that time. Didn't know it existed. And you see also when you, okay, it stimulates very much anagen phase, of course, thyroid hormones, but too quick, and then it gets shorter, and then there can be hair loss if there's excessive hair. You see also this person has some sort of hair loss, but it gets improved with treatment, and you see that she's swollen up and she's unswollen in the next slide. Well, there's a lot of, at all levels, receptors. You see, again, children, completely hair loss, just thyroid hormones, pictures from more than 100 years old, and you see the difference. When you see a child having that, think about that. Treatments is to give thyroid hormones, but the best preparation is preparations that get T3 and T4, not only T4. It's not active enough. Iron deficiency, if the hair is splitting, etc. And sometimes you even have to give shots, but of course with antioxidants you have to give. And zinc can also improve hair, and copper could also improve. But for diffuse hair loss, but typically the most essential is often thyroid hormones, because there is often a thyroid deficiency. Other treatments is shots of vitamin B6 and B9 eventually every 2 to 3 weeks, and not 12 times, a little more, 6 weeks, or something like 18 to 24, and eventually omega-3 and omega-6. But for the hair, it seems that it's the omega-6 who work better, and there are local solutions that can be put in the hair with those sort of polyunsaturated fatty acids that make it work better. Now, hyperthyroidism, too much. So you see again, it's about the same, so we'll go over. But it's a diffuse hair loss that they can have if there's too much. Now, what about the body hair? If a person has low thyroid function, there can be in women a tendency to excessive body hair. And why? The main factor is that this is wrong. I have to put the other slide. You have to correct it. It is strangely a lower conversion of testosterone to dihydrotestosterone, and then lower androstenediol levels in hypothyroidism, because all reactions in the body are normally decreased by thyroid deficiency. All reactions. And so when you see this in blue, you would expect with more male, lesser male hormones, there will be lesser body hair, but that's not true. Why? Because there are other reactions that are not so good. There's a decreased conversion of testosterone to estradiol, because testosterone can go in the two directions, a super male hormone or to a female hormone, estradiol. And this conversion is much more decreased. And so there's a negative balance. There's lowering of estradiol and an increase, and not an increase, but a lesser lowering of DHT, so it's balance in favor of male hormones that will create hirsutism, acne. Acne can be caused by thyroid deficiency, alopecia. And there is also in the hypothalamus, when there's not enough thyroid hormones, increase of TRH that stimulates normally the secretion of TSH, of the pituitary gland, and then it creates not only stimulation of TSH, but also an increase of prolactin. And prolactin is linked in studies with increased hirsutism, acne, alopecia. Because too much prolactin decreases ovulation, and then there's decreased estradiol production. And again, that reinforces an imbalance between the male and the female hormones. There's low male hormones, but there's much, much lower female hormones. So on the skin, there's going to be hair growth, body hair growth. Now, cortisol and hair quality. Cortisol is an anti-inflammatory hormone. If we don't have it, almost everybody of us is dead tomorrow or the day after tomorrow. So we need cortisol. It's that we don't need excessive levels. We need a good ratio. I'm cortisol deficient. I take cortisol since 19 years. I take natural cortisol in physiological doses, not too high, balanced with other hormones, and then it's okay. If I don't take it, what happens to my hair? It becomes inflamed because I don't have enough. And we'll go on this a little bit later, just talk about the positive actions. Cortisol also can decrease a little the muscles, so the hair can, if the cortisol deficiency drop, not be high. There's always a little muscles here that make that the hair can become straight if you want. And this is almost not possible in cortisol deficiency, cortisol excess, I would say, because it decreases muscles, but it can have positive or negative action on sebum, depending on indirect action. It will have a decrease too oily skin if it decreases the androgens of the adrenals. The blood supply, it can be positive or negative, but usually it has a positive action. It can make that blood goes quicker because the heart pumps better. And it can have rather a negative action on interspace. This is wrong. This is a negative action because it decreases the fibrous tissue between the hair and the skin. But a little bit is okay, because if there's not enough, there will be too much fibrous tissue, so the fibrosis of the skin. So you need to have the adequate balance. Collagen fibers really decrease. Is it? And the cortisol deficiency has exactly the opposite. The hair inflames. So what do you feel when you have cortisol deficiency? You put your hand in the hair, and it hurts like having the flu. It's not pleasant. Some people, women or men with cortisol deficiency, don't like that you touch them, because in a certain sense it always a little hurts. If they put a needle and they are treated with growth hormone and they have cortisol deficiency, it hurts because the subcutaneous tissue is inflamed and the skin. So Cortisol deficiency, there will be maybe thicker muscles, there will be everything inflamed, everywhere. Inflammation, and inflammation can also make the whole metabolism bad, and there can be hair loss. The skin will also inflame, and you can have eczema in the scalp, between the scalp hair, with yeast infections eventually. This is typically, at least for cortisol deficiency, this inflammation. And so cortisol and hair loss is typically hair loss in plaques, because the inflammation is not regular all over it. There are certain zones where there's more inflammation. Hair loss in plaque called alopecia areata. You see, hair loss in plaques. And with ACTH injections or cortisol, you really can improve. Also in eyebrows. Think of cortisol deficiency. And what about body hair and cortisol? What is the relationship? You have to know that if there's not enough cortisol, that creates a problem, and that will stimulate by the pituitary gland the secretion of ACTH. Consequence, number one, the skin will pigment, because ACTH on itself pigments more the skin, so they can go in the sun and they brown easily, but irregularly. So they have those senescence aging spots, and other sort of melasma with pregnancy caused by cortisol deficiency, and then too much ACTH. But also too much male hormones of the adrenals, DHEA, androstenediol. So the skin will get too much male hormones. So what happens is, wait a minute, well, we'll see this with DHEA. There will be too much DHEA. So let's first, before seeing what the consequence of cortisol deficiency, too much male hormone, let's look to the actions of DHEA. DHEA can improve the hair. How? By increasing the sebum, but it may not be too much. There's enough oil, I would say, in the skin, and they can increase the blood supply a little bit, slightly, and increases the muscles, so the hair will... When I took first my DHEA, one of the first symptoms of improvement in me was that my hair calmed better. It was thicker because it held it straighter, because of this muscle that is better. And so if you don't have enough DHEA, you could eventually lose hair because of less blood supply and less quality of the muscles here. And everything's okay as long as there's a good ratio of estrogens and testosterone. But if it increases too much, because DHEA is a problem, it converts too much to dihydrotestosterone, it can be toxic for the hair. So there's one hormone toxic for the hair, the scalp hair, is dihydrotestosterone. Could you show the previous slide, please? In the previous slide, I was showing that here estrogens, previous slide, please, that DHEA can convert to testosterone and then to estrogens also, and this is a positive reaction. So it depends about the balance. And how can you know where the balance will go in a person when you give DHEA? Will it go to estrogens or will it go to the androgens? Easy. Look at the person. Look at the skin of the person all over. If there's excessive body hair, that person will make of our DHEA a conversion. There's too much 5-alpha reductase, the enzyme that converts it to dihydrotestosterone. If a person has very poor body hair, you almost have no risk of having excessive hair growth in that person, body hair growth, I would say, because they convert it to estradiol levels. You might even have a premenstrual syndrome in a woman who takes DHEA who has no body hair or poor body hair. So the balance is important between the two. So what happens when the balance is disturbed? We go back to our slide. Not enough cortisol, too much ACTH, too much androgens. Then it will, well, we'll see it later. It seems that there's still waiting to show you pictures. Not enough DHEA. There will be specifically axillary hair loss and pubic hair loss. And treatment locally, for instance, of persons, female adolescents who have no pubis hair growth or axillary hair growth, takes more than a year, about 1 to 2 years, to get this pubic hair there with local creams, depending on the type of problem. You don't have this slide in your... can we show the previous slide, please? Previous slide, please. Oh, they're talking, so sorry. Don't understand. Okay, so this is typically what happens when there's a disimbalance and that there's not enough cortisol, too much DHEA. This is a woman, but she has typically a male pattern, you see? And it's because she's lacking an enzyme, 21-hydroxylase. She cannot convert it in the right direction. So, adrenal androgen excess. Now, what about estrogens? Estrogens are marvelous hormones. They give the typical outlook of a woman, the female outlook with breasts and I would say beautiful hips, etc. So what do they do for hair? And estrogens are secreted by ovaries, as you know, with progesterone. Never forget it. So never give estradiol without progesterone, even in a woman who has her uterus removed. This is very thick hair. Maybe it's false hair, not sure, but it's just to show you that it is positive for the hair. And when there's low estrogens, they have to go and get a special, I would say, haircut, and they have to put some products to hold it, otherwise it's droopy hair. When there's excessive steroids in general, or there can be there's thicker hair and better hair, and it holds better. And estrogens, they improve the proliferation of hair, the hair follicle. There's a special, here in the dermal papilla, special receptors for estrogens. And the blood supply is then increased. It increased blood supply. If there's too much estrogen, a woman is too red. If there's not enough estrogen deficiency is pale. You can spot sexual hormone deficiency just by looking at the person. 100 meters if you want, 100 yards, 110 yards to make the same. Very easy. And when she's excessive, she's too red. Also in men, like this. Huh? Pale men, lack of testosterone, poor sex life. Too much, too red. Just guess about their sex life. Go back to the estrogens, they improve collagen fibers. They make the skin thicker. They improve the sebum gland, or they can decrease, depend on the ratio with androgens. If there's too much androgens, you give estrogens, they will decrease the oily skin. Because if there's too much oil, you can also lose hair. It seems a little toxic. And in estrogen deficiency, will have a poor blood supply, so that's also a reason to lose hair. There will be atrophy of the collagen fibers, so we don't have the ideal environment anymore, and atrophy of the hair shaft. And the skin will be dry, but the hair will also be dry. Dry hair is also a symptom of estrogen deficiency. Atrophy. Also because estrogen stimulates secretion of growth hormone, so if there's not enough estrogen, there's also sort of growth hormone deficiency. And you see that it's very bad for the hair. So, estrogens and hair loss, the typical loss you have when there's a lack of estrogen is vertex balding in women. Diffuse hair loss, thyroid hormone deficiency, hair loss by estrogen deficiency, mostly vertex balding, hair loss in plaques, mostly cortisol deficiency, with also often a lot of yeast problems. And so, balance is always important, because with estrogen deficiency there will be not so much hair loss if there's not too much dehydro, but if the woman at the same time has a lot of dehydrotestosterone, the situation will be worse. This is telogenic effusion hair loss in a woman. Too much hair in the wrong phase, because estrogens stimulate the anagen phase, but if there's not enough, they will be in the telogen phase. And in pregnancy, for instance, there's a lot of female hormones, a lot of estrogens, and woof, the hair is much better, much more percentage of the hair in anagen phase. It grows, it grows. And then at the end of the pregnancy, whoop, there's a drop of estrogens, very severe, so there's hair loss. So to prevent this sort of hair loss, you have to give estrogens after the pregnancy in the beginning. And that's sort of in the 4 months after. Estrogens have inhibiting effect on the conversion of testosterone, dehydrotestosterone, and so they will protect against vertex balding. Remember this slide? When there's not enough estrogens, endogenous, there's a lowering of IGF-BP3, and that's not good. Also for SHBG is also decreased, etc. So the treatment is transdermal creams of estradiol. It's much better. Don't give the oral ones. Transdermal for hair. You want to get hair back. And oral micronized progesterone. And you give progesterone from 15th to 25th day of the cycle. Here, you have to correct this. Transdermal creams in the perimenopause, before the menopause, is from the 5th, and not the 15th, 5th to the 25th day of the cycle in the morning, and in the evening before bedtime, oral micronized progesterone average dose is 150 milligrams. It may be also vaginally given. Eventually you can give an anti-androgen, but I'm only in very big problems, like Androcur, but I don't like it so much. Eventually growth hormone can sometimes in small doses, at least in women who have, for instance, chemotherapy, could have an effect. And vegetable hair oil. Estrogens and body hair, the situation is often not only high dehydrotestosterone, but low testosterone. I have got hair back in women, very strangely, by giving them testosterone and blocking the conversion of testosterone to dehydro, when in the most severe cases, in suicidal cases where I had no results, I went to what everybody's afraid of, and it helped. Okay. Well, let's go a little bit over this. Testosterone hair pump. How much time do I get?
1 minute.
Do you want to have 1 minute for explaining how to get the male pattern hair loss? Is that sufficient, 1 minute? Okay. Well, I'll just say it quick. In my family, they're all balded. On my mother's side, my brother's completely balded, but just doesn't take a lot of hormones. And 3 or 4 years ago, I was losing very much my hair. So when I give a conference, I said, well, it seems that your treatment doesn't work for your hair. So I said, okay, well, fatality. But I did try certain things, like all men who lose hair try. And nothing worked out. Progesterone didn't work, sort of products didn't work, increasing my thyroid hormones didn't work, nothing worked. And then I gave a seminar, and somebody said, well, there was a group of 3 doctors who treated a patient. They found that they didn't understand. They had a man who had too much estradiol and too much dehydrotestosterone, but low testosterone. So what they did is they blocked the conversion of testosterone to estradiol with Arimidex, very strong blocker. They blocked the conversion of testosterone, dehydrotestosterone. they saw the hair getting back. And the man who had no erections with high dihydrotestosterone and high estradiol got erections back. Unfortunately, the first thing he did was to jump in bed with, I think, one partner after the other, and he got some sexual diseases. But with a lot of hair. Huh? Short fun and a lot of hair. So, but I didn't want to block my things, but okay. The problem is if you get finasteride that blocks dihydrotestosterone, I have 2 patients who came for me and who took that during years, Propecia, you get fibrosis of the penis. Who wants to have that? But I take finasteride, 2 milligrams, 2.5 milligrams a day. So, probably I'm going to get Peyronie diseases. How do I not get it? By increasing testosterone, of course. With the treatment, you have to have better erections or as good erections as before, or it's a dangerous treatment. So that's the sign. And so what I did is I misunderstood those patients. I thought they had given testosterone to the patient. So I misunderstood. I took testosterone because I had tried finasteride. Didn't work. I took finasteride and I increased my testosterone levels. And I got my hair back. And it's still getting back after 1.5 years. It's at least 2.5 times more, if not 3 times more. It's also much thicker. I have to go even more frequent to the haircut. I've tried it in other men with success. Even men had misunderstood what I said. They put their testosterone on the hair. It seemed to have good effect, but I would warn you to watch out. You should then take a product with finasteride and testosterone if you do that. But always warn the patient to take enough testosterone. If the erections decrease, increase the testosterone. So what is my level of androstenediol glucuronide? That is the metabolite of dihydrotestosterone. Is it low? No. I have more than before, so I have more body hair than before, but my hair grows back because I have more testosterone than before. Of course, another advantage is that as I have more testosterone, I have more libido, and my wife is more happy. So this is about all these hormones, just to make you remind that hormones can give problems when there's hormone deficiency or hormone imbalance. Toxic hormone, dihydrotestosterone, I would say for the hair. The rest are usually very good. I have tried finasteride in women with total hair loss, hair loss where it didn't work, but first you have to try all the other things and see if there's deficiencies and correct them. But if it doesn't work, it might be interesting to try testosterone, very small doses in women, much smaller than in men. The cream of testosterone liposomal that I put on the places where there's no body hair, because otherwise it transforms into dihydrotestosterone, is 100 milligrams per gram. In women, it's 10 milligrams per gram. In men, I give several grams, or I'm taking 3/4 of a gram. But usually it's 1 or 2 grams. But in women, it is half a gram of a 10 times less potent liposomal gel or a good alcoholic gel of testosterone. Okay? There's no time for questions, I think. Thank you.